Tonight at 6, doctors say they are stunned by the alleged Waterbury captivity case. One is even breaking down the long road to recovery for the victim,
along with the near-fatal issues he may have been facing for more than 20 years. Your reporter Dylan Fearon live outside the home where he was held and allegedly tortured and starved. Dylan.
Well, Mark and Aaron, there are dozens of specific, detailed allegations against stepmother Kimberly Sullivan, but the main piece of evidence in this case is the victim himself, 32 years old, 5'9", and just 68 pounds when he was rescued in mid-February. But yet, Kimberly Sullivan and her attorneys are denying everything, saying she's innocent. Attorney Yanni Kaloidis has been adamant from the start. He doesn't have to explain why the victim was a shocking 68 pounds when he was rescued last month.
And as far as his weight, I haven't seen any medical records yet. And there may be other explanations for his weight. Ask a doctor. That's not for me to explain.
We're taking his advice. Dr. Gianpaolo Ruffo with UConn Health is stunned by the case. He's not treating the victim, but he practices family medicine, giving us a better idea of what the victim's body was potentially put through for 20 years.
Really, I'm amazed and surprised this individual is still alive.
So was the hospital staff treating the victim right after he was rescued. Police spoke to the people caring for the man, who said he was near starvation, severely malnourished with a body mass index of 11, adding this is about half of what it should be. Anything under 16 is considered starvation. Anything under 13 is life-threatening.
As the body runs out of nutrition, it's going to start pulling from different places. So whether it be fat, muscle, bone, other different parts of the body as well, and things really start to break down.
Dr. Ruffo is also addressing attorney Kaloidis' claim that there could be other reasons to explain the victim's extremely low weight.
But there are some psychological issues as well that will that can lead to someone to be significantly underweight, and we're not just thinking of bulimia or anorexia. There's some other ones as well.
There was food in the fridge. There was food in the cabinets. She brought food home.
But was he allowed to eat it?
Yes, absolutely.
But hospital staff told police the victim is likely suffering from cachexia or wasting syndrome, significant unplanned weight loss and deterioration of muscle mass. There's also plenty of concern for refeeding syndrome as the victim starts eating and drinking more. Doctors and dietitians have to be careful easing him into a steady diet.
That too can actually be fatal as well. The immune system is really impaired, and so someone's really susceptible to infection as well.
And Sullivan's attorneys are worried she may not be able to get a fair trial here in Waterbury, Mark and Aaron. Now this case is known around the world. They may consider filing a motion to get this trial moved out of the Brass City. Kimberly Sullivan expected back in court in late April. I'm your reporter live in Waterbury tonight, Dylan Fearon, Channel 3 Eyewitness News.